This is Dr. Epstein. It's maybe one of the more important videos I make as a doctor specializing in revision hair transplants. I'm going to talk about how to repair prior transplants where the hairline was placed too low, there's scarring, and there's really two options other than telling the patient to wear a hairpiece for the rest of their life. A lot of doctors will say, well, get laser hair removal. The problem with laser hair removal is, number one, you're losing the hairs, so you can't replant them, which some of these patients is a relatively minor inconvenience, but the other problem is laser hair removal doesn't take care of the scarring. So the reality is when a lot of these hairlines are placed too low or unesthetically with large grafts, many times they cause scarring of the skin. So the first way to approach that is FUE removal. I do a lot of these procedures, easily one a week now, sometimes to the beard, but more commonly to the scalp. You can see two examples of a before and an after, and another before and an after, where each graft was removed one at a time, and within 2 days to 3 days, it's fully healed up, and then it typically doesn't leave any scarring. And another advantage of FUE is that not only am I not leaving any scarring, and the hairs can be replanted into maybe the old donor site scars or further back, but also, when it's done properly, I'm able to remove a small cuff of the scarred skin around the graft. So we're reducing scarring, not adding to the scarring. So FUE removal really does work. The alternative, another procedure that so many of my patients were told by their local hair transplant surgeon or even a reputable nationwide or worldwide recognized hair transplant surgeon, hairline excision. They're told it doesn't work. That's not true. Hairline excision is really an effective procedure. Let me show you a couple of examples. This is a before, and this is an after. And this is a before, and this is an after. The concept behind hairline excision, it's done when not only is there unesthetic grafts, where maybe it's not dense enough, or it's too dense, or large grafts not growing at a nice direction, but also removes all that skin where that was transplanted. So I'm able to remove as much as 1 inch to 1.5 inches of scarred skin with the old grafts, taking the existing natural hairline, bring it forward, sometimes tightening up the forehead to allow for the removal of that entire area of prior transplanted scalp skin. Yes, it leaves a fine line scar, but these patients are left many times with 1 inch or 1.5 inches wide of scarred skin from the grafting. So, which should not happen anyway, but obviously these are not being done with the right technique or with the desired results. So hairline excision allows me to remove these grafts and replant the hairs. Here's another interesting case. Patient not only had grafting with low regrowth, but then she underwent SMP, micropigmentation, regretted everything. And what I was able to do is excise the entire hairline with most of the SMP, and she was left with a fine line scar that down the road, if the patient really wants to, they can always have grafting done. Sometimes patients don't want any grafting done, they just want to have a bald scalp. And here's a case of a guy, and was really almost a heroic procedure. This guy had multiple rows of large plugs, was unable to go out without a hat or without a hairpiece. And in his case, I had to use balloon expanders. I'm not going to show you what that looks like because that's all you're going to remember from this video. That's not what I want you to remember. But I had to stretch out his forehead skin and stretch out his scalp skin, and then I was able to remove 2.5 inches of these prior placed plugs with all the scarred skin, close everything up, and you can see here, yes, there's a fine line scar, but it's barely, if at all, detectable, and the patient was immensely satisfied with the results. So, take-home message. Prior hairline grafting can be treated with FUE removals and or hairline excision. They're both great techniques when done in the appropriate patient with the proper technique. Remember that? Thank you. This is Dr. Epstein.